Hello, Happy New Year! Ako si Das Gavilan. Kayo ay nanonood ng bagong episode ng Newsbreak Beyond the Stories kung saan hihimayin natin ang mga maiinit at mga halagang isyu sa Pilipinas. Sa episode na to, ang unang episode natin para sa 2022, pag-uusapan natin ang coronavirus situation ngayong simula pa lang ng taon. Wala pang isang buwan, January pa lang, wala pa nga halos 30 days, pero ang taas na ng bilang ng mga kaso ng COVID-19 sa bansa. Ano ang factor sa likod ng surge na to? Na for sure na kung hindi ikaw, kapamilya mo, kaibigan mo, may kakilala ka sigurado na may COVID-19 ngayon. Ano ang dapat gawin ng gobyerno para matigil na yung surge na to or hindi na maulit yung pagtaas ng bilang ng kaso na to? Kasama ko ngayon si Sofia Toma Cruz, rapper reporter who covers the coronavirus pandemic and the government's response to this health issue para talakayin ang isyung ito. Hi Sofia, thank you for joining me today.
Hi, Jades. Thank you for having me again. Happy New Year.
And Happy New Year. Ikaw yung last episode ko last year and then you will open again dahil napakalaki pa ring issue ang coronavirus, third year into
Mm-mm.
this pandemic. Pero
Tama.
bago tayo magsimula, I have a lot of questions about our situation. I would like to remind our audience na pwede silang magtanong if they have any comment or if they have any question or opinion about the issue that we're talking about today. Just comment down below and we will try to our best to answer your questions as the program progresses. Pwede sa dulo, wala sa gitna, kung saan ito babagay. So, make sure na if you have any question, stick the entire program, watch the entire program. So, Sophia, for my first question, we're entering the third year of the pandemic soon. That's in late February, March or late February. Ngayong simula ng 2022, can you tell us ano na ang sitwasyon ng pandemya ngayon sa bansa natin?
Right. So, we welcome 2022, in the same feeling a lot like the pandemic wasn't in its third year or in disbelief that the pandemic was already in its third year because I say disbelief because for the last week we've been tallying record high numbers. So just today we posted on January 12 we posted over 30,000 cases again, and that's the second 32,000 cases, and it's the second highest daily tally after January 10. And just in this week alone, like I mentioned, record high numbers talaga. So that's the state of the health crisis right now here in the Philippines. Um, we are shattering records that we already set during the surge partly driven by Delta back in 2021 around July to September, and it can be very unnerving, I guess, for some because we had really hoped to leave all of that behind us. We ended 2021 with our lowest case numbers since early on in the pandemic, and here we are again with record high numbers. So that's just the lay of the land right now in terms of case numbers. And in terms of hospitalizations, let's say, currently the country is still technically under a low risk classification, but then we know, of course, that with so many people getting sick, that also includes our health workers. So, um, we are still in crisis mode.
Yeah. You mentioned that we're hitting all-time numbers, no? And then, as you mentioned nga na this was the highest compared to the Delta surge that we had. What happened? Kasi parang at the end of December nga, parang high spirits sa lahat kasi 300 cases, tapos marami na lumalabas, and then parang people were saying na baka the worst is over. Then biglang
Mm.
third year na tayo ng pandemic, biglang ganito kataas na you'd think na since malapit na parang 3 years na into this pandemic, dapat paikli na numbers like what we're seeing in other countries. What happened? Anong factors
Mhm.
behind this surge na nakikita ng mga sources mo or ng mga sinusundan mo mga experts on this?
Yeah, well, I think if you can call it a curveball, although and in one sense you can't call it that, but really the big game changer here is once again another variant. This time Omicron, the latest variant of concern. And I know we talked a little bit about this last year. Pero kahit wala pang official declaration of local transmission here in the Philippines, which should mean that the variant is here, circulating and circulating widely and all over the country. Even if we don't have that official declaration yet, all the signs are here. And at the same time, you don't need that declaration to know you have to act. So I would say that really the biggest game changer that, took us from where we were last year, how we closed the year off with much lower case numbers to record breaking numbers is usually Omicron. And just to give a picture of how big of a game changer this really is less than a month ago, not even a month ago, perhaps, fine, let's say a month ago, we were only reporting cases in, now we can say only in the hundreds. Back then it was, I mean, 4 weeks ago, hundreds were still hundreds, right? We always want it to be lower than that. But then today we posted over 30,000 cases, like I mentioned. So it's really Omicron that's the game changer here.
I know in our last episode for 2021, we tackled Omicron, no? But to refresh our memory, can you tell us ano yung dapat malaman ng public tungkol sa Omicron variant? I know before you mentioned na kaunti pa lang yung alam natin dito when we closed the year in 2021. Pero ngayon ba may mga bago tayong information or data on this new variant?
Right. So let's always yeah, to have a refresher, let's just look at it at this through the lens of three questions that experts always ask whenever we see another variant, whether that be a variant of concern, of a variant of interest, or a variant under monitoring. So, first of all, the transmissibility of Omicron. This is really its biggest threat right now. It is extremely contagious. It is already, if I'm not mistaken, around 2 to 3 times more infectious than Delta, which we already know it was much more infectious than the original COVID-19 strain. And because it's so infectious, this is why you see cases really exploding. Here in the Philippines, the Department of Health said that the like the way Omicron spreads so easily, it's translating to cases doubling every 2.2 days. That's really, really fast. And the implication, of course, of extreme contagiousness and transmissibility is that it is so much harder. It's that much harder to contain COVID-19. And the threat or the risk of the chances of you getting infected is that much higher because that it spreads so easily. And I think that you and I know that firsthand. Of course, people here watching also know that firsthand because you have not just one friend or one family member, but you have several people who are testing positive. And right now in Metro Manila, around one out of every two people, 50%, yeah, are testing positive. So that's on the first account of transmissibility. And then of course we also look at severity. Now I think early on, it's probably worth revisiting this question because early on, a lot of the news was revolving around the fact that Omicron seemed milder. But we have to put into context, of course, that this is milder compared to Delta, which is not mild, and neither is less severe compared to Delta, which in itself is not severe, and Omicron itself also isn't mild. So we know that because it's still putting people in the hospital and it's still killing people, and so you can't say that the virus is mild. It is less severe compared to Delta, and the reason why. But then you might ask, right? Like, okay, but if other people are getting infected, and again, you can't say for certain if it's Omicron because you'd have to sequence your sample. But let's just assume if it's Omicron, how come my symptoms are so mild if the variant isn't quote unquote mild? Well, if you're vaccinated, uh, one big reason why the infection isn't as severe as it might be is because of the vaccines and they're working in you. Scientists are also still trying to really figure out what exactly might make um, Omicron less severe than Delta. So this is something that they're also still really watching. But then the bottom line here is that Omicron isn't mild. It is less severe than Delta, but it's still, of course, something that we need to be careful and something that we should avoid. We still should avoid getting infected as much as possible. And then the last question about a variant that experts always want to answer right off the bat is, how does it affect our vaccines? And long story short here, just a quick recap again, is that it does affect the performance of our vaccines, but we know that protection against severe disease is still intact, mostly because there have been some studies, preliminary studies that have shown that T cells, which is um, T cells are your body's way of killing infected cells, so and preventing an illness to preventing an illness to from progressing into even more severe forms. So that still stays intact, and it still recognizes Omicron. So yes, there is somewhat of a dent in the performance of our vaccines against infection, but then that's also remedied by getting another dose with a booster.
Yeah. And para Sophia, if there's one thing that I've learned about, like reading about COVID-19, about the experts, about your stories, parang hindi mo talaga mape-predict kung kailan siya tatatapos, 'di ba? Kasi 'di ba parang may mga surge nga na, or they've surge in the sense na may taas ang cases, may bababa, tataas ang cases. Pero itong napakalaking paglobo nitong January 2022 sa Pilipinas, itong record-breaking numbers natin, did you, your sources, or even the government expect this sudden surge? Or were there elements na you thought it's going to happen naman, na tataas ulit yung cases, but not at this intensity?
Well, I think because other countries were seeing the rapid increase in cases beforehand, before the Philippines, we had an idea that this was coming. Of course, you never really know how it's going to hit a country until it actually does. So the sky high numbers, there was some sort of warning beforehand. I think though that something that we didn't entirely, well, actually, I think something that we should also keep in mind is that even if we're talking about expectations, there are also projections being made. Those projections are also affected by many things, and in between the time that they made those projections and the time that in the time we are in now, where cases are really shooting up, a lot of that can be, those projections could be affected by many factors, right? Like how well you and I and other people in the public comply with minimum health standards like masking, for example, and ensuring good ventilation, and then also how fast we can vaccinate people. So yeah, to a certain extent, this was expected, but um, you know, projections are also something that are heavily affected by our behavior.
Yeah. And there are people saying that the Omicron and this surge, yung variant na meron ngayon, at yung pagtaas ng cases natin is golden ticket out of the pandemic. That's like verbatim quote, diba? Hindi to totoo, I'm sure, kasi parang wishful thinking ito. Bakit ito parang maling pag-iisip na ganito yung sabihin mo na baka yung Omicron yung magtatapos ng pandemya sa bansa?
You know, I really, like other people, I really wish we could say that with certainty, but I think that's the biggest I think that's the trouble with saying something like it's the golden ticket out of a pandemic, or it's the beginning of the end, for instance, because we can never really say that with certainty. Um, uh, you know, there's so when I was listening to all the experts who guide our response, not just in the Philippines but also internationally, the takeaway is always, if you keep giving the trouble with thinking that it's less serious is that it's not the case for all people. Sure, maybe you and I, if we get infected, will be okay because we're young, but it's not the case for other people. And you really the danger with that thinking is letting infection spread. And we know by now that if infections spread a lot, then that's exactly how the virus changes and keeps on mutating. And in that sense, letting Omicron run wild and free, for instance, doesn't there's nothing really um or the possibility of another variant emerging that's more transmissible or more deadly than Omicron isn't impossible.
Yeah.
And in that sense, the pandemic really won't be over. Like we're just going to be here again. And I think another danger with that thinking also is that right now our vaccines do work. We wouldn't want to let another variant emerge that could affect our vaccine performance even more, because that would be just bad news for everybody. Mhm.
Yeah. So, medyo dapat worry tayo when saying that it's the golden ticket out of the pandemic. Pero tingin mo, are there any information or at least semblance of any hint na what or any information kung what would bring the end of the pandemic, or mahirap pa rin malaman, nahihirapan pa ang experts natin kung ano yung parang key recipe to ending this pandemic, not just in the Philippines of course, but also around the world, the global scale?
I don't think there would be. Well, we know what we need to do, right,
Yeah.
to end the quote unquote end the pandemic. I think end the acute phase of the pandemic, right, where we're in crisis mode. We know what we do. We know what we need to do to make that happen, which would be to ensure widespread vaccination, to ask for that from our officials, to make sure that happens here in the Philippines, for instance, to ask that it also takes place on a global scale. That's one of the ways that we could see the end of the acute phase of the pandemic. But then also continuing to wear masks, continuing to practice distance, continuing to ensure good ventilation. These are some of the ways that we could quote unquote end the pandemic, or end the acute phase of the pandemic. I think I also just wanted to, sorry to like to just jump back a little bit. I think, you know, just on your point about Omicron being a golden ticket out of the pandemic, you know, we still have to remember that there are people um, who are unvaccinated but can't get vaccinated, for example, for medical reasons. And these are your senior citizens. These are the kind of people that you need to protect. And these are the kind of people that we should also be thinking about. The most vulnerable people in the pandemic, not to mention kids.
Yeah.
Um, Kids who can't get vaccinated yet, because there's not enough supply yet here. Or the vaccines for 5 to 11 year olds, for instance, are still on their way, have yet to arrive. And we have kids younger than 5 years old who can't get vaccinated, and these are the kind of people that you need to think about and you need to protect. So, you know, um, it's still important that we do our best to not get infected, and to not drive transmission. And in doing so, you protect, of course, your vulnerable these vulnerable people. And you also, this is also going back to your latest question, that's also how you quote unquote end the crisis part of
Yeah.
the pandemic, because we know, of course, that a pandemic won't end overnight. There are also going to be a lot of long-term effects that we'll be seeing in the years to come.
Yeah. And talking about vaccination, can you tell me ano na yung vaccination rate natin ngayon sa bansa na 'to, and how big is a factor is it na ngayon na siguro emphasize na natin na bakit in the past years na like first year ng pandemic or at least entering the second year 2021, 'pag tumataas ang numbers natin, marami talagang namamatay, maraming na-hospital. So, parang gaano kalaki yung factor yung vaccines ngayon na kahit mataas yung numbers, or parang yung numbers ng deaths ay hindi naman like of course it's still bad that there are people dying, but compare mo sa past 2 years. So malaking factor dito rin yung vaccination, no?
Yeah, definitely. Vaccination is a big factor here. And I think that's one of the stories that we see right now as well, is that vaccines do work. Um, and we see that because, for example, in NCR, a lot of, yeah, there are a lot of infections, definitely. But DOH has found that, for example, if you look at the hospitalization, uh, 85% of people who are in the hospital are those who are unvaccinated. And if you look at research coming from other countries, so these are mostly focused around mRNA vaccines, which are also available in the Philippines, but then yeah, they're just a few two among the pro in the portfolio that we have. But then if you look at that, the chances or the risks of the unvaccinated are way higher than if
Yeah.
you are vaccinated. Um, if you feel sick right now and you're not worried for if you feel sick and things the infection right now is minor, that's also your vaccines working. And um so if we're talking about the impact, for example, or how big of a factor vaccination is right now, it's a huge factor. It's really saving a lot of lives right now. And I think that if you, and this is also something that we need to remember, right? Like, yeah, things are very grim right now, but then this is a clear example of how we're not in 2020. If these were the kinds of numbers we were seeing in 2020 without vaccines, I don't need it's a scary thought to even think about how many people could be
Yeah.
dying
Yeah.
every single day. But the fact that vaccines are here and that around, I'm looking at the figures right now, around 49% of the population is fully vaccinated. It's such a huge
Yeah.
thing. It's really saving so many lives. So vaccines do work. Of course, I think just as something last thing I'd like to add here is that um one of our technical one of the members of our technical advisory group for the DOH, Dr. Anoong Lim, made a really interesting point and a really timely point, I think, in the recent days about vaccination. We need to be also realistic about what we're asking from vaccines. And it's really just going back to what they're supposed to do for us, prevent the severe outcomes, hospitalization, severe disease, and death. Infection would, of course, we would want it to prevent infection, but then the fact that it's the fact that we don't have as many deaths right now as we probably would have if this were 2020 and vaccines weren't available shows you really that vaccines are working and that it's saving a lot of lives.
Yeah, kasi I have friends na they have comorbidities na hindi lang simpleng asthma, but very like immunocompromised sila basically. So if they got the COVID-19 without the vaccine, that really spelled death for them. Pero ngayon na may nagka-COVID sila and they were vaccinated, even boosted kasi they already got the booster shot na, they only like mild symptoms like cold and cough, and then they were good na after 5 days of isolation. So it really drives the point talaga na how important yung vaccines na, lalo na even if may comorbidity ka, but kahit sobrang healthy ka pa, kasi we know of healthy people who succumbed to the COVID-19 in the past 2 years. Pero you mentioned nga na yung numbers natin sa hospital, hindi siya comparable na sa uh, the past 2 years. Pero ano nakikita mo pa ng epekto ng pagtaas ng kaso sa healthcare system natin? Meron pa bang mga parang worries na baka mag-burden pa to lalo at bumalik sa pre-2022 levels ng uh, hospitalization rate or ng parang utilization rate basically?
Well, it's too early to say right now. I think if it will, well, it's on its way. The hospitalizations are definitely increasing, and any increase, of course, will be felt by our health workers. In terms of how our health system is doing, the effect of the increase in cases, I think what's hard this time around is, of course, you can talk about like we can talk about how the proportion of cases that need hospitalization this time around being lower compared to Delta and everything. But when we look at how things are on the ground, um, all those numbers, of course, matter. But then what matters more is how our health workers are doing, and what's different about this current surge is that it's not the first surge. It's I'm trying to count in my head right now. One, two, three, four. Let's say around the fourth time cases have really shot up this high and have really put severe stress on our health system. So if you and I are recovering, are still trying to recover from 2020, what more are health workers, right? Um, and of course, our beds have increased since then. We've had more. We've been able to beef up our resources more since then. But then we can't say the same for our health workers, and I think that's really where the biggest effect is right now. Um, um, it's really on our health workers, and how this surge is coming on top of all the other surges that we've had. And so um it's I think it's a challenge in a it's challenge it's presents a challenge in a different way. More and more health workers are getting infected, and you see that we've had to short the government has had to authorize shortening quarantine and isolation for health workers. And at the it's really not an ideal situation. But then the alternative, of course, is seeing our health system. I don't want to say collapse, but it needs to keep functioning. So
Yeah.
sadly, that's the effect it's having right now.
And let's talk about government response, no? In the past episode natin, you talk about ano yung nagkulang sa government. Pero ngayon na we're seeing a surge now. What should the government do now in response to these high numbers we're seeing? And ano yung worst case scenarios na nakita mo if they don't do these recommendations based on experts and scientists na monitoring and pursuing this pandemic?
Right. I think in the immediate term, I can think of some things short term and some things long term. First, something short term, I think that we really, really need to find a way to get testing more accessible, make testing more accessible, I mean. And we have been talking about this since 2020, and we mentioned it again in 2021, and it's 2022, and we're still talking about the same thing, right? But then we, you know, um, testing there our testing capacity is definitely increased, but then you can't say the same for access. Um, Tests are still so expensive here in the country. And now there's a whole other market, right? Antigen tests. So they're also very, very expensive. So really, testing is one thing that we still need to improve on. I would also say that one of the things we should do in the short term is really sit down, or um I really want to hear the government talk about how we're going to improve ventilation, what kind of investments we're going to be making, and let's say in our public schools, so that so that the kids can go back to school. Their education is doesn't have to be interrupted again. It's already been disrupted in the last 2 years, so it's also another immediate thing we have to do. I would also um and this one, we're in the process of kind of we're on the way there, but it's still really slow, I would say. Is how we're monitoring our health system. So right now it's really still on beds and on ventilators, but then we have learned by now, of course, that the beds need people to keep functioning. So I think it would be interesting to, not interesting, but really important that we add our health workers. So we have to figure out a way to measure how many of our health workers are able to still work to make sure those beds are functioning. And I think long term, well, of course, fourth being, I mean, I will say it, even if it's obvious, vaccination needs to really be more widespread outside of NCR. So NCR is the story in NCR is, yes, there are so many cases, and hospitalizations are definitely increasing because of just the sheer number of infections that we're seeing. But vaccines are really helping us here, and we need to be able to say the same for other regions as well. Long term, what I really what I think we should be looking for right now is, I guess, a big picture, or just a strategy of how we're going to be treating this virus in the years to come. It's definitely not going away anymore. And I don't know about you, but if I'm trying to picture just even the end of the year, or this time next year, I don't know how you and I are supposed to be thinking of COVID-19 as both as journalists and as regular people. So I think there needs to be some direction from the government on that. It's not too early anymore at this point to be thinking about how we're supposed to be treating this disease, and how we're supposed to be how we're going to be coping with COVID-19 in years to come, quote unquote, living with the virus. So I think that's one long term issue that we really need to figure out right now, if Omicron's not making that more obvious for us.
parang I was going to ask you ano yung worst case scenario, pero you mentioned na yung sa parang the way you describe it sa dulo, parang nakakatakot na siya. Pero Sophia, I wanted to also ask you pa rin, what are you afraid that will happen if hindi magawa itong mga recommendations na both short term and long term na na-mention mo kanina? What's the worst that can happen? Siguro based sa mga
Mm.
experts sinasabi. Pero ikaw personally, from your 2 years of following this pandemic,
I'm worried. I'm scared about another variant emerging, I'm not an expert in terms of, like genetics of, the evolution of viruses. But, I if when I hear experts saying that it's not impossible that another variant of concern emerges that's more transmissible and more deadly, that's one thing, of course, that's scary to think about. I'm also worried that if we don't move fast enough, then we're going to miss our chance of getting the virus under control. Um, because right now we can still do that with our vaccines and with our current health measures like masking. So that's one thing that's scary. And I think um, another thing that makes me worried, of course, is that if we don't address all the things that we just mentioned, because if we're going to be living with COVID-19, as they say, then you definitely need testing to become more accessible if it's going to be a regular thing in people's lives. And you definitely need um, safer spaces, schools, malls, public transport. And um, you definitely need people to also get vaccinated. And I think that's the scary part for me, that we're not going to be able to, or we're still going to be talking about um these things in the years to come.
yeah. For my next question, I wanted to ask you what to expect in the coming months in terms of numbers. Kasama na rito, parang related na rito yung isang tanong sa comment section sa Facebook. Sabi ni Ryan Stanley, as the number of daily cases skyrocketed, what is the probability that the Omicron will outpace Delta variant within this month? I'm not sure
Well,
if we can already see that based on the data that we have, but do you have any information on this?
well, I can't say for certain about like timelines when that might happen or anything. But then, Omicron replacing Delta, that's definitely a possibility that's been mentioned by the World Health Organization, also different health authorities in other countries, and that's a trend that we're also seeing in other countries as well. Most recently, here in the Philippines, in the last sequencing of all of samples, Omicron was the variant that they detected the most out of those samples. Although it's a small sample, and only one of several that have already been done. But if that's an indication of things of where things are going, we'll still have to see. But yeah, in the last run, for example, 60% of the samples were Omicron, and it's the first time I think that happened since we've been sequencing it. Before that, it was still Delta that was the majority of samples. But then whether or not it's something that we'll see happening in the Philippines is definitely one thing we'll be watching. And um if we're talking about, yeah, Omicron overtaking, it's already happening in some countries, so it's definitely not impossible.
Yeah. And for me, last question, we're already a few months before the May 9 elections for presidential elections sa Pilipinas. How do you think this surge, itong rising numbers natin, will affect people's, like, uh, do you think it will, siguro, malaking chance na marami ang restrictions na ilalagay in place? Or, knowing the government, Sophia, do you think that it will implement more restrictions as the election nears?
um Well, it definitely still means that we still need to be. I mean, the government has to really, the urgency of figuring out how to run a safe election just grows by the day. But I think, other than the logistics of the elections, I think one thing that the phase we're in right now is really emphasizing is how, um, well, I might be biased because I cover the pandemic, but then I think it's really emphasizing how important the pandemic plans of our candidates, of our, sorry, not yet candidates, of our aspirants are. Um, And I think that everybody should be really looking to what these aspirants are saying that they're going to do about the pandemic, what their plans are. And personally, I'm looking for a lot of details. It might be too early in like it might be too early to be asking that, but then really, if we've one thing we've learned by now again is that the devil is really in the details. Um it's really different to have like a grand plan and have things always just stay in the big picture, but then really drilling, really um, breaking that down into details and concrete actions and steps is so important, as we've learned by now. So I think, yeah, for me, what does it mean for the elections is really, it's really emphasizing how important the pandemic and the government responses as an election issue. It's one thing we really should be demanding demanding to hear about from people who are running in the next election. And I think that it's one thing that we should be um eh, we're talking about the next administration, but then also the current administration. It's one thing that we should be holding them to account for, that just because you only have a few months left doesn't mean that slowly wean off and let it transfer let the next administration handle everything. Like, there's still so much things we can do right now. There's still so many things that we need to do right now. So really, for me, it's really just emphasizing how it's really one of the foremost issues right now, especially as election years.
Yes. Napakarami nating napag-usapan ngayong gabi na 'to 'no, and parang hindi pa naman umaabot ng isang buwan simula nung nandito ka last month. Pero parang hindi mo overnight, pero napaka-quick ng pagbabago sa COVID situation.
Mhm.
And yung based sa napagkuwentuhan natin ngayon, maraming nagbago sa Omicron data that we have. And I'm sure na ang audience natin at ang public ay abangan pa yung mga next na development sa sitwasyon natin. Bago tayo tapusin 'to 'no, basahin ko lang yung isang experience ng isa nating commenter sa YouTube, si Arkijek. I'm sorry if I'm butchering that your username, pero sabi niya, this person is currently recovering from COVID. Mas nakakahawa yung Omicron. Got it from my brother who is a doctor. Dumaan lang siya sa corridor ng house, I absolutely expect nothing from the government. So, parang yung pagkakahawa ng Omicron naman ay matagal na siyang information. Pero from what I'm seeing, talagang for many people, naging reality kung gaano ka intense yung transmission rate ng Omicron ngayon, dahil na-experience nila na 'to, na people na we know na hindi naman lumalabas or lumalabas na ng bahay para kunin ng delivery, na nagkaka-COVID sila. So, it goes to show talaga na hindi biro itong Omicron na 'to. So, ayun, thank you, Sophia, for
Definitely.
joining us today. Alam ko lagi kang guest sa podcast na 'to, but every time you come, marami kang bagong impormasyon dinadala, and I'm looking forward for you to also join us again, hopefully with better news na. Kasi last month medyo
Yeah.
good news kasi bumababa ang numbers, eh. Pero this month medyo alanganin. So, next time na you guest here, sana best na magandang news na. Let's keep our fingers crossed. To our audience, kung gusto niyo sumali sa discussion, not just on the coronavirus pandemic, but the situation in the Philippines, the issues in the country, pwede kayo sumali sa Facebook page ng Rappler. Ang pangalan to ay Rappler Room. Makikita nyo yung link nito sa comment section at sa screen niyo at sa caption ng story ng video na to. At kung gusto niyo pag-usapan yung anything related to the election, sabi nga ni Sofia, dapat maging election issue ang pandemic response. Dapat i-highlight kung ano ang plano ng mga aspirants na pag-handle ang pandemic ngayon na pasok na tayo sa third year ng pandemya na to. Dapat tayo rin as voters, dapat malaki ang discussion natin at mapainit yung discourse dito. Kaya kung gusto niyo sumali sa discourse ng Rappler, pwede kayo sumali sa PH Vote na Facebook group. Andan yung link, nakita nyo sa comment section at pati na rin sa video na to. Yan sa baba nakikita nyo. And so, maraming salamat sa panonood sa ating mga viewers. Kung gusto niyo sundan ng issue na to, huwag kalimutan na palagi bisitahin ang Rappler website. Don't forget to also like and subscribe sa YouTube ng Rappler. Kung nanonood kayo sa YouTube, i-hit nyo na yung subscribe button at yung notification bell. Pati na rin sa aming ibang social media accounts tulad ng Facebook at Twitter. Samahan nyo ulit kami next week para sa bagong episode ng podcast na to. Ako si Judas Gavilan at ito ang Newsbreak Beyond the Stories.